So one of the difficult challenges is telling a patient that they've got breast cancer. We try if we can to warn a patient. So if we feel a lump that feels like it could be cancer, or if we see an image that looks like it could be a cancer, try to give some warning signs so that the patient's a little bit prepared. We give them their treatment plan right away so that they know what to expect and what is to come, because the waiting is the worst.
After my residency, I came up here to Andrews Air Force Base in 2002. I had the pleasure of taking care of military personnel and also the opportunities to be deployed twice, once to Qatar and once to Iraq. In a way, it strengthens your comfort with yourself and with your abilities, having to be put in that situation, because certainly when I first arrived in Iraq, I did have some concerns about being on call all the time, never knowing what's coming through the door. I have this background that I feel comfortable that if something does happen unexpectedly, that I can deal with it in a calm and calculated way. I think the whole decision about working and balancing a family is a very personal one. I certainly have a lot of friends who made a different decision. You know, they worked before, and once they had children, they stopped working, and they love it, you know. And sometimes I'm envious of that, to be quite honest. And so I choose to make sometimes difficult decisions.
So I think the key is at different times of your life figuring out what your priorities are. But right now I have two priorities, and one is having a very successful breast center where we're providing excellent care for patients, and then that I have a happy home life and that my children, know that I'm there for them and that I want to be with them. I think one of the things that's difficult for working mothers is making sure that you feel good about what you're doing at work and also what you're doing at home. I think that's one of the greatest challenges. When I'm at work, I'm focused at work, and that's all that I'm thinking about. And when I'm at home, I'm focused on home, and that's all that I'm thinking about.
Actually, I think probably being the mom is more difficult because you don't really get any training for that. With the physician part, we spend a lot of time, between medical school and residency, learning what we need to do. And certainly there are some things that you learn along the way as well. However, I wouldn't trade being a mom for anything. It's been really wonderful. I believe I've been given a gift that I should use in terms of my surgical skill and also just caring for patients with breast cancer.